All right, today we're going to break down a clinical protocol that's all about bringing some order and really effective care to something that can be, well, pretty chaotic, methamphetamine withdrawal. We're going to see how a clear, systematic approach can totally transform how patients are managed for the better.
Okay, so let's dive right in. The core challenge? It's right here. When someone who uses meth regularly suddenly stops, they don't just feel a little off. No way. They enter a full-blown state of withdrawal, and it's this really complex, really distressing syndrome that is just incredibly tough for the patient to go through.
To really get why the withdrawal is so intense, we've got to understand the drug itself. Methamphetamine is the super potent stimulant, right? It basically pushes the central nervous system into overdrive. Think hyperactivity, no need for sleep. So when you suddenly take that away, the system doesn't just, coast back to normal. It crashes hard.
And that crash, it brings a whole menu of symptoms with it. I mean, we're talking about intense cravings, just bone-deep fatigue, and a really low depressive mood. On top of that, you often see severe anxiety, irritability, agitation, and all of this is happening while their sleep is just completely haywire. Trying to manage all of that at the same time? That's the real challenge here.
And look, this isn't just a 24-hour thing and you're done. The most intense part of it, what we call the acute phase, typically lasts for about 7 to 10 days. Think about that. That's a long time for someone to be in that much distress, and it creates this absolutely critical window for healthcare providers to step in and offer some real effective support.
So that leads us to the big question, right? With all these severe and varied symptoms popping up, how on earth can care teams provide consistent, effective management for every single patient? I mean, just reacting to problems as they happen, that's not going to cut it. You need a game plan. You need a system.
And that system, it has a name. It's called the Methamphetamine Withdrawal Management Protocol. Now, this isn't just, a list of good ideas. It's a standardized, evidence-based approach. The whole point is to get ahead of the problem, to manage the withdrawal proactively and stop agitation before it even has a chance to start. And the beauty of this protocol is how simple it is at its core. It's really built on this clear, two-step foundation. It all boils down to a really logical flow. Step 1, figure out what the symptoms are. Step 2, do something about it based on what you found. Simple, right?
All right, so let's dig into that first step, screening. The tool that really drives this whole thing, kind of the diagnostic engine of the protocol, is called the Amphetamine Withdrawal Questionnaire, or AWQ for short.
So this is what it looks like. The AWQ is a super straightforward 10-item questionnaire. Now, here's a key detail. It's not actually filled out by the patient. It's for the clinician. They rate the severity of the symptoms based on what they've seen and talked about with the patient in the last 24 hours. And they do this every single day to keep a close eye on how things are changing. And what I think is really cool about this is how the questions get right to the heart of what the patient is going through. They're not super clinical or jargony, they're direct, they're human. Things like, have you felt sad? Or have you been craving sleep or sleeping too much? And that's so important because it lets the clinicians take these really subjective feelings and turn them into actual data they can work with.
Okay, so the AWQ gives you the data. What's next? Well, that brings us to step 2, intervention. And the protocol lays this out in a really clear, tiered approach.
And this right here really shows you the core philosophy of the whole protocol. It's not about jumping straight to medication. Absolutely not. Tier 1, which is the first and most important step, is all about behavior. Then you have Tier 2, the medications, but those are kept in reserve, only for specific or more severe symptoms.
So the big takeaway here is that the first line of defense is just fundamental human care. We're talking about the basics, making sure the patient is eating and drinking, cutting down on overwhelming stimuli, quiet rooms, low lights, letting them sleep when they need to, even encouraging some mild exercise, like just going for a walk. This stuff sounds simple, but these actions can have a huge impact on helping the nervous system regulate itself.
Now, this doesn't mean medication is off the table, not at all, but it's used strategically. Tier 2 interventions only come into play when those Tier 1 behavioral supports just aren't cutting it for specific problems, like really severe agitation or insomnia that just won't quit. Think of it as a targeted tool in the toolbox, not the first thing you grab.
So when you put it all together,
You've got the daily screening with the AWQ, and you've got this tiered behavior-first intervention plan. What you end up with is a system that just works. It's incredibly effective. So let's talk about why it works so well.
The biggest thing is that this protocol completely flips the script from being reactive to being proactive. Instead of waiting for a crisis, you're screening every day, which means clinicians can see problems coming and hopefully prevent agitation before it spirals. It also standardizes everything, so it's not a guessing game. Every patient gets the same high-quality, evidence-based care. And critically, it always prioritizes helping the body heal and regulate itself before jumping to meds.
And honestly, this quote from the source material just sums it all up perfectly. It's like a simple, powerful mantra for the whole team. Scan for the AWQ and know the intervention. That's it. Look at the questionnaire score and you know exactly what evidence-based step to take next. It takes all the guesswork out of it and just replaces it with clarity and confidence. So in the end, what this protocol really does is provide a clear, actionable roadmap for what is otherwise a really complex and difficult situation. It literally brings order to chaos. And that kind of leaves us with a bigger thought, doesn't it? If this works so well here, what other challenging areas in healthcare are just waiting for a simple, standardized, evidence-based system just like this one?